Hi, my name is Isabella Antic. I'm a second-year resident at the University of Kentucky Department of Internal Medicine in Bowling Green, Kentucky. The title of my clinical vignette is A Suspicious Thrombocytopenia. So I'll go into a quick summary of the case report. Essentially, this was a 30-year-old woman who had presented to the hospital with severe thrombocytopenia. Prior to this, she had some pretty significant nausea and vomiting for 2 weeks, initially thought to be a viral gastroenteritis. Upon presentation to us, we found she did have a past medical history of psoriasis and lupus nephritis, however, no other pertinent medical history. Her thrombocytopenia was also very new, as a month prior she had a normal platelet count. Hematology was consulted. We held off on any plasmapheresis, thinking, could this be a hemolytic uremic syndrome? Could this be DIC secondary to a gastrointestinal virus? Or could this be TTP, or thrombotic thrombocytopenic purpura? Something that we took into consideration was the signs, or the pentad signs that we look at with TTP, such as fever, thrombocytopenia, hemolytic anemia, renal dysfunction, neurologic dysfunction. Upon presentation, the patient only had thrombocytopenia, which led us to think, or led us to believe, that TTP was lower on our differential. However, as her stay progressed, there were more and more signs that this was possibly TTP, as patient during her stay developed a stroke, had schistocytes on peripheral smear, and then finally, when the labs returned, also had an ADAM TS13 deficiency. So when we started her on plasmapheresis with now a diagnosis of TTP, she drastically improved. This goes to show the importance of keeping a broad differential and rechecking on your patient daily any new signs and symptoms, checking with your nurse, making sure you're following along closely, especially when the picture is not so clear. And you can hopefully prevent detrimental side effects with the appropriate diagnosis and treatment. Some photos here on my posters you can see in the lower right hand corner, or if you're looking at the screen, the left hand, some schistocytes on peripheral smear. Also here in the middle, she had some bruising, obviously all over her body with the severe thrombocytopenia. And then she had the stroke, which were all definite signs, but they all showed up later during her hospital stay, which made the diagnosis a little bit harder to place until later on. Thank you for listening to my case report.